So, welcome everyone. Today I am joined with Maribeth Wright. I'm so excited to talk to her because she was part of the transformation program. So, welcome, Maribeth.
Thank you, Dr. Aarti. Happy to be here.
Yeah. So, tell us a little bit about yourself and what brought you to the program.
I'm recently retired in the last couple of years from a long career in the auto industry, technical project management. Was a good living, not necessarily a passion, but uh, I made it through. And when I retired, I expected to feel a certain way, and it didn't turn out that way. And a year into it, I was kind of in a bad place and looking for ways to get out of it. And when I say a bad place, I surprisingly had uh, some some ill health, but it wasn't directly related to any sickness. I got colds frequently and would get bronchitis afterwards. I was having skin issues and some inflammation responses and some digestive issues and mood issues. And I was like, what
Mhm.
is going on? And, you know, I I didn't want to go down a rabbit hole of 10,000 doctors. And I talked to my primary care doctor who had some advice about diet and exercise and um, at one point prescribed Adderall, which I thought was kind of weird. I didn't really take it.
Mhm.
Um, and but I had all the regular blood work done and everything was fine and she wasn't worried about any systemic issue at all.
Mhm.
And I thought, what's going on? And then I started investigating functional medicine a little bit
Mhm.
and reading about it and looking at reviews. And I thought, well, sounds good because it's more holistic, but it just looks like a expense rabbit hole.
Yep.
It's like trading medicine for supplements that insurance doesn't cover and maybe getting ever deeper into this. I don't know. I didn't know where it would lead,
Another
but it
rabbit
didn't,
hole, a
didn't
different
feel
rabbit
right.
hole. Yeah.
Yeah, a different rabbit hole. And it didn't feel right. It just felt like just another avenue. And then through a mutual contact, I met you. And ironically, the functional medicine practice that I had thought about going to turned out to be the same one you were going to be leaving.
Oh my God.
And you explained some of the reasons for your decision, and they were some of the same things I had been thinking. And one thing I remember that you said was, um, okay, so you go from traditional Western medicine to functional medicine, which is attractive because it's more holistic and potentially integrated. But a person should ask themselves, but why do I need all the supplements? And take another step toward a holistic approach. And I think that's where you and your transformative practices come into play, because they treat an even deeper root than the functional medicine does. And that was very attractive to me, and it turned out to be very real and very transformative, as you had expressed that it could be.
I'm so glad.
Did
There's
I answer
nothing
your
wrong.
question?
Yeah, yeah, no, no, no. It's good for someone to hear your story because I know there's a lot of people out there that are struggling with symptoms. And the natural next step for a lot of people who have failed conventional medicine is to go to functional medicine because it's the next, it's the sexy thing. And there's nothing wrong with it. Like, I think it's well intended, but it kind of, the culture that I felt like it created was that it wasn't empowering patients to learn their physiology and learn how to become more adaptable, which is where health lies. And
Mm,
so, like, that's where I was getting frustrated in clinic because it was like training people almost to be like, give me the natural thing that's going to fix me versus like, how can I train myself? Use that in the meantime, whatever it is, a few
mm.
supplements, of course, like they're going to be helpful. Medications, even helpful. Use what you got to use, but ultimately train this so that the symptoms resolve on their own.
Right. And as we will get more into the details, I did experience that through the process of going through your program. And I don't think I could have done it just if someone said, try Yoga Nidra and find a free Yoga Nidra on YouTube or whatever. It wouldn't have had the same impact.
Yeah. Yeah. And that was one thing I would ask you is like, there are a ton of free stuff, and like people would be like, well, I'll just, do it online. Like, do you think, what was it about doing it in a structured way that helped you kind of move through your health journey?
Yeah, there were different aspects. One was the I don't want to call it accountability because you didn't keep track of how often we did it or anything like that or how often we attended, but just knowing that there was a check-in every week um, kept me in a week to week focus, and I would keep track of how many times I practiced Yoga Nidra during that week. And it was kind of a checkpoint to evaluate how I felt each at the end of each week. And obviously, a person can do that with a journal, but there was something about, I mean, I've tried programs with journals and stuff before, and I don't always stick to them. And you don't really know if it's working either. And with this checkpoint of coming together with you and others every week, I could really check my own progress well.
Yeah, that's great. And you were also very ready for it, which
I
was another
was. I
thing.
was
Yeah.
very ready.
You were very ready for it. So, I mean, one question would be, who do you think this program is not for then?
Uh, if probably heard that saying where you have to feel bad enough to want to make a change, you know,
Mm,
I think
hmm.
for somebody that's just generally exploring the surface of a bunch of ideas, maybe not that person.
Yeah.
I think it's for someone who sees where they want to get to, but is really having trouble getting there. And for me and many, many women my age, it's physical, but it doesn't even have to be physical. It could be any kind of a goal oriented thing that you want to accomplish with the intention setting and everything.
Yeah. So, what improvements did you see?
Okay, so this was really interesting because I was really focused at the beginning, even ahead of when you started, you had put me onto that book about breathing.
Hmm.
And so I came into it prepared and ready, and the benefits I saw were fast. They were, very very much geared toward the beginning of the program. And I started to feel better, and I'll describe the symptoms in a minute, but I started to feel better quite quickly. And that made me kind of this is such a human nature thing, but I just drifted off near the second half, right?
And that's okay, right? Like you
Well,
mentioned,
but
yeah.
the improvements stayed.
Yeah.
The improvements, it surprised me how much the improvements stayed. So the digestive issues resolved completely
Hmm.
and have not returned. The I was having this skin breakout whenever I would imbibe, once a week in some drinks and bar food or something. My skin would break out. That has resolved to the point where I can do that once a week and it doesn't happen, which
Hmm.
amazes me.
Hmm.
That one really surprised me. Um, when it was, earlier in the season, like in the summertime, and I was practicing consistently, my happiness and mood really improved. I remember saying to my husband, I just feel really happy. I just feel happy. That has since tapered a little bit because
Hmm.
inconsistent practicing and also winter in Michigan.
Yeah, and I think not it's not to make it wrong, right? Like winter is a season where we are going to feel a little bit more tired, and that's okay. I think our culture kind of makes it wrong.
Yeah,
You're depressed. But it's like we go through seasons and we go through in life. We weren't meant to be like go, go, go 365 days a year.
true.
So, yeah, it's
Yes.
just like, is it wrong? No, it's not wrong.
So I've had, I have had improvements. I still could improve more. I still seem to get sick a lot. And I want to like re-energize around this and kind of do another lap. In my mind, it turns out to be kind of a lap, like, oh, practice consistently for 4 months, then not very consistently for 4 months. I want to do it again, and kind of like a step function, I want to hit another step function.
Yeah, yeah. And I think thank you for your honesty, right? Because I think that is, a lot of people's maybe trouble with it sometimes, is the consistent practice. But I think one thing that you do mention is, or you've told me, is that you were able to kind of start practicing and doing it on your own. And I think the consistent, like the symptoms resolving, is also you trained your nervous system to become more adaptable, right? It's not necessarily yoga nidra is the magical thing, and you have to use it like a medication to keep your symptoms going at bay. It's a practice for life, right? It is a way
Yeah.
of being. And so that was one big thing is like trying to flip people's I guess, assumption about meditation or using it like a medication in the beginning. Use it, there's no judgment. Use it because it's like it is for physical restoration first, right? And then only can you evolve out of that.
Yeah, I haven't thought about that aspect of it too
Yeah.
much. I should consider that even more. Um,
And that's
but
okay. When you're not feeling well, the first 6 months to a year, it's probably just for physical restoration, and that's okay.
right, right. One thing that I wanted to mention that I really liked about being in a longer term program with you is you had these modules that went along with the practice. And in my mind, I called them bite sized modules. They
Yeah.
were never overwhelming. And also, like some of the topics I was already really aware of. And some of the ones I was aware of, I was doing already. And some of the ones I was aware of, I didn't do because I was never going to do them, for whatever reason they didn't work for me. But other ones were new and I tried them and some of them I kept. You always said keep what resonates with you, what works for you and let the rest go. So that again, you're not overwhelmed, right?
Yeah.
And the modules that resonated with me the most were the breathing and the hydration. And I make a little
Mm-hmm.
drink salt and this fizzy thing with zinc and vitamin C every morning to try not to get sick. And those were the two that new ones that resonated the most with me. But all of those modules aside, the actual practice itself was what was the most transformative. I think what it did is I think I was in fight or flight mode since I was 9 years old when my mom
Yeah.
died. And then we were in this dysfunctional family. And then, you know, growing up and getting married and having kids and getting divorced. I think I was just, it was the only way I knew how to live. And I also used to have this weird habit where sometimes I would wake up in the middle of the night, or not really the middle, but 4 or 5, and I couldn't go back to sleep. So I would just get up.
Mm-hmm.
And I I thought it was a type A personality, let's go kind of thing. But in hindsight, I think it was just that anxiety and fight or flight reaction and not being able to sleep. So I'm getting a lot more sleep now. But what I wanted to mention was I think the yoga nidra allowed me to reset my nervous system so I'm not in fight or flight all the time.
Mm-hmm. And it's like
And
one of the things we have you do is like map out your nervous system. And most of us don't know that we're actually not in a state that is in a state for repair. So naturally, symptoms will arise if you're not repairing well.
yeah,
And that's why the yogis say awareness is the medicine. And, a lot of us are not aware in our culture because it is pretty fast paced. It is go, go, go. It is, we've normalized a lot of the behaviors
we
and
have.
adaptations. So
Yes.
we don't recognize that this is not really what it is.
Yeah, my normal was not a healthy normal. And I my nervous system was not at a healthy state almost all the time. Well, it worked until I got old enough. Two things happened. One, I got old enough in my aging of my body where I couldn't compensate for it anymore. You know,
Hmm.
like when you're 20 and you this is just an example, but when you're 20 and you go out drinking, you can recover well the next day. But when you're 80
Right.
and you go out drinking, you can't. I mean, there are just results of an aging body. So my body couldn't compensate for the way I was treating it anymore. And the second thing was with retirement, I kind of had to think about things where I hadn't
Mm-hmm.
for years and years and years. So
Mm-hmm.
those two things together was like something has to change. And I think the Yoga Nidra practice was the key, and
I'm
it
so
has
glad.
changed.
Yeah.
Yeah.
Did you experience anything during the nidras that was beside, like you said, you felt better, but was there anything experienced where stuff came up where it was like, like emotional
No,
or physical or anything?
no.
Okay.
I'm aware of that phenomena because once years ago when I did a kind of a slow yoga program for exercise, I started crying at the end of it, and I was like,
Mhm.
what's wrong
What's
with me?
going on?
Yeah, and other people do have that happen, but for me in this program, that didn't happen. I just felt peaceful, and and now most of the time I'm not in the fight or flight.
Yeah. What a different way to live through life, right?
Yeah, and little things like I sometimes I'm actually late for something because I'm not paying attention to the clock, and uh, I don't try to get so many things checked off a list every day,
Yeah.
and I'm able to say that's fine, you
Yeah.
know.
Beautiful.
Yeah.
Any other last comments or
Did we think we
I think we
I'm
covered.
just going through my
Yeah.
mental checklist here. No, I really appreciated the opportunity to be in your first program, and thank you. I want to say thank you for really changing my life.
No, thank you for being a part of it. For me, it's also a journey because it was a journey outside, conventional medicine, outside of functional medicine. And I was like, this is the way I think about things. Does it work? And you had not seen me in clinic before. So, like, it was a fresh start from a new, like, person who had never done anything of the way I was thinking. Um, and so thank you for being a part of my journey too as a physician. And I really appreciate you and thank you for taking the time to share your story. I think a lot of people will see themselves in you and know that there is hope.
Well, best wishes to you, and you're very brave.
Thank you. Thank you so much.